Akol Robina from Lira district conceived at the tender age of 16 years. Upon the condition, her parents forced her into marriage with the man responsible. During antenatal, she realized body changes from her private parts.
I produced my baby. He's too much sick. My poo is coming and my susu is coming, but I don't know where I go to her.
Upon delivery, Robina was then referred to Terrewode Women's Community Hospital in Terrewode district, where she was diagnosed with fistula. Her pains then turned into a nightmare when her husband kicked her out of home.
My husband is not seeing me good. He told me, I don't want you. What?
Outside home, the surrounding was equally rebellious.
Okay, when I go back home, the people see me. It's not see me well.
Medics at Women's Community Hospital say previously the cases were common with mothers over 24 years, but since the lockdown, a number of admissions are teenage girls below 24.
Usually the most common age group that we had been seeing previously within the hospital was between 25 to 45 years, but of late the number below 24 is starting to go up.
To contain the escalation, today the hospital administration called a stakeholders engagement that constituted district chairpersons, RDCs, and district health officers from Lango and Teso sub-regions. The leaders demand government to incorporate fistula in general and referral hospitals.
So there is need for partners and government to put more resources for the same kind of facilities to be established in different regions across the country so that access is easier. If you realize when these people were giving their testimonies, there were referral issues, transportation.
The hospitals, these other general hospitals we have in the country and referral hospitals should have some sort of clinics specifically to handle such cases, and where possible, link them to these hospitals such that time and on, they should be visiting those clinics and meet some of these patients.
District health officers say a number of medics in the region are ill-equipped to handle.
The health workers in this country, the problem is with their training institutions. So there is very little focus on fistula. Of course, that explains the reason why for a long time there has not been much awareness about this condition, much prioritization about this condition. It's a neglected condition.
These causes of fistula normally come as a complication of obstructed labor, where we have a big baby compared to the mother's maternal pelvis, so that when there is labor, woman may take labor for many days, and then you find the head rubbing on the walls of the urethra, whereby after that friction, the hole develops. But that's after complicated labor, so that with the time the baby comes out, baby may come out alive or dead, but then this leakage of urine comes after.
The leaders now plan to launch a survivors empowerment program for women affected to boost household income. According to a BMC Pregnancy and Childbirth Report 2020, 1 to 2% of Ugandan women have symptoms of fistula, of whom only 62% have sought treatment. The World Health Organization estimates that worldwide, between 50,000 and 100,000 women develop each year, and 2 million women live with untreated fistula in Asia and sub-Saharan Africa.
The program to empower these young women to become